And the management of Kenya's health data systems and surveillance remains a contentious issue, even as President William Ruto witnessed the signing of a Kenya-US cooperation framework that will foster a 25-year partnership. This memorandum of understanding establishes a framework for long-term collaboration between the United States and Kenya to strengthen public health systems, improve disease surveillance, and achieve specific health outcomes by 2030.
Insiders who are part of Kenya's delegation told KTN that the Memorandum of Understanding on Health was scheduled for signing 2 weeks ago, but disagreements on these two issues, health data systems and surveillance, caused the delay. The cooperation covers multiple health system pillar surveillance, laboratory capacity, commodities, frontline health laboratory workforce, health data systems, and technical assistance. Significant commitments include expanding epidemiology and laboratory staff, transitioning procurement and supply chains, integrating electronic medical records and national data platforms, strengthening biosafety standards, and adopting agreed-upon systems for managing pharmaceuticals, laboratory operations, and outbreak data. This comes amid Kenya's health financing crisis following the stop work order by the US government in January this year. Freeze on the foreign aid greatly affected major health programs, namely malaria, TB, HIV/AIDS, including health data systems. President Donald Trump's order left a funding gap of 30.9 billion Kenya shillings, money expected to manage health products and technologies, human resources, health management information system, and the health system strengthening. Of the money, 140 million Kenya shillings is for health information systems. The health ministry has acknowledged that data systems depend heavily on donor funding for regular upgrades, maintenance, and technology updates. The experts are opposed to data sharing, saying it is against the Constitution of Kenya, Kenya Data Protection Act, Health Act, Digital Health Act, County Government Act, and National and Integration Data Government and Sovereignty Standards. Dr. Mugambi Laibuta, advocate of the High Court, Kenya and data governance professionals, said sharing of data is not legally compliant. It poses critical constitutional and sovereignty risks and must be significantly renegotiated before Kenya can lawfully sign or operationalize it. The statement highlights that granting the US real-time access to national health information systems endangers citizens' privacy under Article 31, violates devolved health government requirements, and exposes critical infrastructure to national security threats. The agreement also prioritizes US federal law over Kenyan law, which the advisory identifies as unconstitutional and a direct erosion to sovereignty. The advisory concludes that the DSA must be substantially renegotiated before Kenya can legally adopt it. Recommended reforms include removing real-time access, inserting KDPA-compliant safeguards, enforcing Digital Health Act requirements, correcting the governing law to Kenyan law, adding termination controls, and ensuring county-level consultation. According to America First Global Health Strategy, the U.S. government will work with recipient countries to develop long-term plans for monitoring service delivery and epidemiology data. Agutu Rosa, KTN.
The National Council of Churches of Kenya